Our eyes are windows to the world, and at the heart of this gift lies the retina, the canvas of sight. The retina works like a camera film and converts images into signals, sending them to the brain and allowing us to see in color and detail. When the retina is damaged by diabetes or other conditions, vision is affected. Millions face vision loss and blindness from retinal diseases. Mission Vision is committed to highlighting this invisible crisis.
Doctors who are part of Mission Vision pledge to protect a vision and fight avoidable blindness.
By raising awareness, timely detection, and advanced care. Through collaboration with multiple stakeholders, Mission Vision aims to make retinal health a national priority.
One of the most important things is the awareness at all levels from all the stakeholders, not only just the patients, but all the healthcare providers to be aware of this. I think that will make a big change in preventing this to to becoming a blinding disease.
We all are aware that India is the diabetes capital of the world, and because of that, there is an increasing number of patients suffering from diabetic retinopathy. As per me, the need of the hour is to create a lot of public awareness regarding the blindness associated with diabetic retinopathy. And as we all know, prevention is better than cure. It's better we intervene early and save a number of people from going blind secondary to diabetes.
The most important thing is for patient to be aware that retina could get affected in diabetes and other condition which can cause blindness, and that would affect not only him, it will affect his entire family, entire circle, and eventually our economic loss to the nation. So my message is that any patient who has diabetes or any other retinal disease should get immediate checkup by the retina. And the second awareness is for the physicians who are treating diabetic patients. It should be mandatory for them to get their retina examined. Blindness is not a disease, it's a curse, and we as a nation have to work together to get rid of this curse.
The most important actionable as far as retinal health goes is to make a policy change. Make it mandatory for screening to occur, and once screening occurs, have a reliable pathway wherein the treatment also is afforded. It is not just important that we detect the disease, but also to ensure that the patient gets the required treatment, and that too timely. If the patient reaches us late, I think the damage will be done, and something that could have been prevented, we would have lost vision in that particular patient.
The most important thing is awareness about retinal diseases. So, unless we are aware of something, we will not be able to take any action against it. So, once we know that there is a possibility that the retinal diseases can affect you, can cause a blindness, so you can prevent that from happening. So, that's the most important thing in controlling retinal blindness.
So I think in our country where literacy is not evenly distributed all over the country, and people are not aware what blindness means for them. Blindness basically means either cataract, and they come for cataract surgery. So therefore it's very, very important for them to be made aware that diabetes can affect the eyes. And so most important is to increase awareness amongst patients, so that if a patient is diabetic, they ask for their eyes to be examined. We should increase awareness amongst physicians to make sure that physicians refer the patients to concerned ophthalmologists who can screen these patients and treat them, and also we make increased awareness among ophthalmologists who are not practicing retina to do a cursory screening examination for all the patients so that diabetic retinopathy can be detected at early stages so that we can prevent because I'm a retina surgeon and we see a lot of complicated cases of diabetic retinopathy which could easily be avoided if we timely detect them and timely intervene for them.
Retina health as a national priority is a priority today, and that is because of the curse of the diabetic retinopathy burden on the society, which is going to increase over the next decades if we don't take care now in every way possible, improve awareness, improve capacity building, and improve the situation of providing the amount of treatment as well as diagnostic aids to the community directly from the PHC levels to the tertiary care hospitals, then we are in for a very difficult time in the near future. So we must pledge to improve diabetic retinopathy blindness from whatever levels they are to a minimum of approximately 1% in the near future, 2030.
No one should miss a retinal screening by 2030 if that's possible at all.
A patient, once you know you're diabetic, it's instant in your head, okay, I need to get my vision checked. And then you are able to get that checked seamlessly at different, we had a discussion of, you see the weight machine in the railway stations and other places. Can we make it that accessible to all patients? And then when they do reach a physician, then there's follow through. It's not a one-time thing. It's not that, it's well controlled, I don't need to go back. So our conversation was more around integrated and how do we provide that patient experience.
I think that is most kind of where we can involve in everything. And then see what other years we can say guidelines to say department heads or medical colleges that at least train your postgraduates in doing, say, basic skills should be there.
Under human resources, good general ophthalmologists, well trained in basic procedures, and having a uniform pattern of training is important. And as far as policy and funding, yes, there is a lot, but there is an NCD wellness screening from the government, and probably diabetic retinopathy could be part of that. And I think the lack of awareness of catching it early, thereby making it cheaper for all stakeholders and better in the long run for the patient, that has yet to be understood.
The diabetic retinopathy also, but no one's talking about the diabetic retinopathy. So it is a neglected. We have to give the priority. So prioritization is very important for diabetic retinopathy. If one to address number one, we have program like RBSA. Can we improve that and integrate the retina health into RBSA? We have program for NCD, and so we already are doing the testing or the screening for diabetes. And the simple issue is that we also have Ayushman Bharat digital mission where we are linking people with their health conditions or their health EMRs. So all and it can be just that very easily, like anyone we take with the diabetic condition has to go for eye screening.
Join us in safeguarding the gift of vision before it is too late, with awareness, timely screening, and treatment. Mission Vision, because everyone deserves to see tomorrow.